Alright, so this is
Like,
our
can they
3D
put this
reconstruction.
on a disc or
I can ask
does it
if they're
work?
able to do that. It might be just as good to have it on here, just because then you don't have to mess with
Oh,
what other downloads you might need to show it. Okay, so
Oh yeah.
this is the right atrium, right ventricle, pulmonary artery. This side of the heart takes blood from your head and from your lower body and sends it to the lungs to get oxygen. And once it goes to the lungs, it comes back through what we call pulmonary veins to the left side of the heart. So usually there would be two veins draining here to the left atrium and then veins draining to the left atrium from the right lung. But in Emma's case, we have this one tiny one draining from a portion of the right lung, but we have the majority of her right lung pulmonary venous return. Instead of coming to the left atrium where it can be pumped out to the body, coming back to essentially the inferior vena cava right atrium connection. So this is blood that should be going out to the body, but instead it's coming back to the right side of the heart. So this is where we have to create a way to get this nice oxygenated blood back to the left side. So instead of cutting it here and stretching it over to the left atrium, we want to use essentially a tube graft to be an extension cord. All right, so this is her 3D reconstruction. You can spin it all the way around. This is the right ventricle and the left ventricle. And so what happens over time if you leave this and don't do anything is that this is extra blood, right? This is extra blood that the right side is seeing that it's not supposed to be seeing. So what happens is the right side is like a water balloon. It's just getting stretched and having to work a little bit harder than it planned on. And so it can dilate the right side of the heart, which over time can lead to rhythm problems, to her right ventricle being tired and saying, listen, I don't want to do this much longer. And like Dr. Ectasati said, we usually don't see it until a kid is either gets a random x-ray because they stuck their finger in a light socket and the right side is dilated. I guess I don't need to be recording all of this.